Good evening, everybody, and welcome to our next session. And as we have all of you watching, the one thing that we all know is that the growing rate of CKD, not just in the country, but across the world. And we also know that dialysis is a life-changing process where probably it's the only way for patients to live or continue to live on chronic kidney disease. However, what no one talks about is the different challenges that one faces on dialysis. And today, this is exactly what the session is about. And with me, I have Dr. Shyam Bansal, one of the leading nephrologists in the country and the secretary of the Indian Society of Nephrology. And we're going to be taking a lot of questions that have come from dialysis patients. So before we start, thank you very much, Doctor, for joining us this evening.
Thank you very much, Marin and Kidney Barrier Foundation for inviting me for with this very interesting session. And I think it's always actually have the interaction with patient directly and to discuss their questions and whatever their difficulties are rather than any recorded or pre-planned program. So I'm looking forward to it, and I hope that this session would be really good for them for their queries.
Thank you, Doc. I hope to. Doc, so I'm going to start off with, I think, one of the most common problems patients have on dialysis. And I'm going to start off with blood pressure. So it's one of a common complaint that patients have. Suddenly their blood pressure rises on dialysis and suddenly their blood pressure falls on dialysis. So I'm going to approach this question in two different ways. The first is, why does blood pressure rise on dialysis and why does it fall on dialysis? And the second part of the question would be, what can patients do immediately, not to panic that this is happening, and what they can do immediately to be able to regulate themselves and come back to a safe zone before they reach out to the doctor, because we find patients just panicking and not knowing what to do.
Yeah, thank you. This is a very actually good question and very commonly faced problem by patients. So let me explain you because it will need a little bit of explaining. So what happens whenever a patient develops chronic kidney disease, and particularly when he comes to the reaches the stage of kidney failure, when he needs the dialysis, when he or she needs the dialysis, that time, because of the poor kidney function, your water, fluid, and salt start accumulating in the body. That is the reason for the blood pressure, increase in blood pressure in the patient with CKD and kidney failure. So, if somebody is not taking their medicine properly, or the in between dialysis, if the gain of the weight, that is mainly because of fluid. If it is more, then the blood pressure would increase. And as we start the dialysis, we do the dialysis and remove the fluid. So many times this blood pressure comes down. So this is very common. So the cause of the increase in blood pressure is increase in the fluid and salt. And if you are not doing proper your diet restriction to control that, the blood pressure would increase. And secondly, if you also miss your medications, if your blood pressure is high particularly, then your blood pressure would increase. And now coming to the question of blood pressure getting low in the dialysis. So there are two or three reasons. So one is that during dialysis, as we remove fluid and salt, the blood pressure also comes down. So if you remove too much of the fluid at in a short period of time, then what happens, this fluid which is there in the vascular compartment, it actually comes from the interstitial compartment. So if your rate of filling of the fluid is less, uh, then we are removing the fluid, then the blood pressure will fall. So it is always recommended that one should not gain too much of the weight or fluid during dialysis so that you don't have to remove a large amount of the water, and the blood pressure will not fall. If somebody has tendency of blood pressure going low during dialysis, then it is advised that before dialysis, he or she does not take his regular antihypertensive medicine so that the blood pressure fall during the dialysis could be avoided. So And in some cases, so this happens mostly, but in some cases, what happens, the blood pressure actually rises during dialysis, despite there being a little fluid. In that cases, you have to give certain medication, especially the ARBs or AC inhibitors, which is because of the increase in running during the dialysis. So that those medications can be given, but that has to be seen by a nephrologist. This is prescribed on the case to case.
Doc, your voice is breaking up for me.
Okay, okay. So which part was not clear?
Can you continue talking, Doc?
Yeah. So I was saying that if in some cases, it's the mostly during dialysis.
Doc, your voice is breaking up, Doc. It's cutting.
Okay, so should I apply headphone or something? Because from my side, the transmission is clear.
It's like it's
Am I
cutting here
audible
and
more
then.
now? Is it
Your
still?
voice is coming continuously, but your words are breaking up.
Okay. Uh, am I more clearly audible now?
Yeah, Doc. Now you're more audible. Yeah.
So,
Can
so
you
I was,
start off with low BP, Doc?
yeah. So the low blood pressure during dialysis occurs if there is a lot of fluid is being removed at in a small short period of time. So if you try to remove the a lot of fluid like ultrafiltration of more than 3 liter or 4 liter in a single session, then the rate of filling of the fluid from the interstitial compartment from where the fluid come to the vascular compartment is really less. And so it is recommended that you should either limit the fluid removal in a one session, and secondly, you should not take your regular antihypertensive medicine or reduce it before the dialysis session if your blood pressure is going low. The second cause of the low blood pressure during dialysis could be either somebody is having a heart disease or somebody is having a liver problem. So these two are the other causes of the blood pressure going low in the patients who are on regular dialysis. So one has to see on the case to case basis.
Can you share more about somebody having heart disease and the blood pressure going low? What is the science behind that, Doc?
So, see, the heart diseases are very common in patients who are on dialysis.
Yeah.
I tell sometimes that if you are having a kidney disease, then your probability of dying because of the kidney failure in dialysis are very low if you are getting a dialysis adequately and on time. There are two most important reasons for the death in the dialysis patient. Number one is the cardiac diseases, and number two are the infection. So one should get regular cardiac checkup, and if the cardiac function, heart function is low, then because of the heart problem, your blood pressure can go low during dialysis. So that is about the heart disease, and then it could be various type of the heart disease. Usually, it is the ischemic sort of heart disease that can cause low blood pressure during dialysis because heart cannot take the sudden removal of the fluid during dialysis.
Doc, a very layman question. Can this be prevented by any chance? Of course, you mentioned that for high BP, it's about taking the medication. And but is there any chance of protocols patients can follow to at least avoid the risk of the BP falling or rising? What would you advise, Doc?
Oh, yeah. So I mentioned earlier, the one is that there should be there the intradialytic weight gain should not be more than 2.5 to 3 liter. Even if it is less, then it would be better because if there's a lot of weight gain, then if you try to remove so much of fluid, then the blood pressure would go low. Secondly, if you are on antihypertensive medicine for hypertension, then if your blood pressure is going low during dialysis, then you might need to skip your medicine, at least half of the medicine on the day of dialysis, so that blood pressure does not go low during dialysis. So these two things can be done to reduce the chances of the hypotension during dialysis.
Doc, since you brought in the topic of heart disease, so heart disease is something very common for patients on dialysis. And I think the longer you do dialysis, your risk of picking up uh, other problems is
Mhm.
way higher. Would you
Yes,
agree with that, Doc?
yes. Especially two things. Mainly the
Mhm.
cardiovascular diseases, means heart diseases, and secondly, the risk of infection. So risk of these two diseases, and these are the, as I mentioned earlier, these two are the main causes of death in patients who are on dialysis.
Mhm. Okay. There's one patient who's spoken about tiredness after dialysis, this
Yeah,
extreme fatigue that patients go through.
yeah. So
So, what are your thoughts?
this is a very common symptoms in patients who are on dialysis, and there are multiple reasons for that. So we have to see it from holistic point of view. So one is obviously the dialysis is not the complete treatment for kidney failure. One dialysis does 4 to 5% of the kidney function. So effectively, you are doing 8 to 10% of the kidney function in dialysis. So you are not giving the best or the optimal treatment. You are just giving the treatment which can continue, take you through the life. And secondly, whatever we are doing, it is not physiological in the sense because our kidneys are working 24 hours a day, 7 days a week, and we are trying to do that in or three sessions in a week. So you are trying like somebody is trying to clean his house once or twice a week as compared to daily. So there would be fatigue. And that is the reason. But how can we overcome it? But then secondly, issue is also psychological. The people who are on dialysis, they think they are not good, they are not healthy, or they are not doing activities. So that is the lack of exercise, sedentary life habits, and the depression. I think many of them because of the uh, depression, social issues. These are the some other things which are also responsible for fatigue. If the person is suppose demotivated, then he's obviously doesn't do many things which should be done. The person on dialysis should be engaged in other activities, means the social activities, in exercise, in other things also, which is very important. The dialysis is not about only prolonging the life. That is one aspect. But the
Mhm.
other aspect is that you are also doing your work, your purpose of life. That's important.
Thank you, Doc. So, what I hear you saying that I think one of the secret mantras on dialysis is also having a purpose in life that keeps you going and not restrict your life to
Getting
just
that.
a dialysis. So that itself could drain you when you don't have anything to look forward to. So your whole mental energy goes on just thinking about this one thing. So you have to be able to channelize that energy by doing something more productive,
Yes. And one
singing,
more
dancing,
important
sports.
thing
Yeah,
I
yeah.
tell my patient is that good diet is also very important.
Mm.
So many patients on CKD, they are accustomed to not to take protein, which is
Mm.
very bad if you are on
Mm.
dialysis. So
Mm.
high
Mm.
protein diet, good protein
Mm.
diet is a very important
Mhm.
aspect of being well on dialysis.
Okay.
One should take high protein diet and
Mhm.
good protein. I tell
Mhm.
my patient, you eat as much as protein you can take. It is not
Mm.
going, your kidneys is already not working. Kidneys are not working. You should take high protein or as much as protein you like. It is not going to harm.
I like the next question that's coming up. It's my favorite question because I used to ask a lot of patients, why do you want to have a transplant, including my husband? And I remember he always says, I want to have a transplant because I can drink water. And I realized that dialysis patients really enjoy the smaller joys of life, which is drinking water in this case. But we are now in the summer season. So as a professional, medical professional, how would you, patients cannot drink water, but what are the tips that you can help patients do when they feel thirsty during summer?
Okay, so let me tell you. So there are two types of patients on dialysis. Of course, more majority of the patients who are on dialysis,
Mhm.
their urine output is less, 80 to 90% of the patient. But there are some group of the patient who have kidney disease
Mhm.
because of the interstitial
Mhm.
nephritis, where urine output is maintained. So in those patients, you really
Mhm.
need not to restrict too much of water. Now coming to the majority. So obviously. this is a human tendency also. Whatever is restricted, you long for that more. That is the thing. So once you are restricted in water, then you want more water. So to reduce this urge, one should drink cold water. That is important. If you don't drink cold water, if you drink warm water, then this is not going to quench your thirst. You have to, or you can take some ice cubes so that the amount of the water can be restricted. And second important thing is the salt. If the salt is more, then you have to take the water obligatory, because then it becomes a requirement. You cannot actually control your thirst. So less salt, avoiding the salty things like pickles or papad or things which are high in salt. So like packaged food, all these things should be avoided. The salt should be reduced by 50% of the normal, and then water should be the cold water one should drink, so that you can reduce the amount of the water. Obviously, some restriction has to be done, but by doing these, nowadays there are many actually mouth coats are also there, where you can spray this coat and your thirst is reduced. So that is also available in market. That could be one way for those who absolutely cannot control their thirst.
Doc, what's your take with, so obviously the type, most patients on dialysis also cannot pee, right? Most of them. Is that, did I get that right, Doc?
So this is, let me tell you. So this once, see what, when we start the dialysis, it is usually when the kidney function is 6 to 7%.
Yeah.
At that time, most of the patient have some urine output.
Yeah.
Over a period of time, whatever remaining kidney function is there, that keeps on deteriorating.
Yeah.
And after some time, 6 months, 1 year, 2 year, 3 year, then this patient will stop producing any urine.
Yeah.
So that happens with with the progression of the kidney disease.
Mhm.
Yeah. So what was your question?
The question is, so now that there's no urine output, how about secreting fluid other ways? For example, like swimming or any other kind of workout where fluids and toxins can still come out to your body, but not through, but through sweat. Is that, is there
No,
any, does that make sense?
no. So see, the insensible losses always occur, whether you are passing urine or not passing urine. So if you do some exercise and sweat it some amount, then you can maybe usually the what doctors recommend, your insensible fluid loss is 500 ml. This is roughly estimate. If somebody is not producing any urine also, then in that case also we would give 800 ml or something like that, so that his daily losses can be compensated. But so he can do all the exercise and everything, and take this rough amount of 400 500 ml as an insensible loss. But if somebody is sitting in AC all the time, then obviously the insensible loss would be less. So one has to factor these things also.
Thank you, Doc. Doc, another question that I wanted to ask, since you spoke about diet on dialysis, which is one of the ways to maintain their blood pressure, okay? What do you think about the supplementary powders, Doc? Would you recommend them?
So no. So I normally do not recommend any supplementary protein powder during dialysis, except for those who cannot take protein requirement by diet on, like somebody who is very strictly vegetarian, and then by the giving all vegetable protein, if she is not able to meet the protein requirement, then we will of course recommend for the protein supplement powder to actually reach to that target. But all those who can fulfill their protein requirement by diet only, I will not recommend. But in our country, you know, a lot of people, they are vegetarian and they don't take too much of protein. So practically many of them would require the protein supplement to reach to the target of the protein which is required in during dialysis.
And thank you, Doc, for that answer. And can you elaborate on bone problems, arthritis, joint pains on the journey of dialysis, Doc? Why does that happen? And can it be prevented? At which stage can it be prevented? Is there something that people are missing with regards to phosphorus and joint and bone problem? Can you elaborate a little more on that?
Yeah. So as I mentioned earlier also, the one of the
Mhm.
important thing which is lacking in our dialysis patient especially is lack of exercise. So
Mm,
lack of exercise, any sort of exercise keeps your muscles get weakened, your joint get weakened, and that is why you develop all these pains and ache. That is the one reason. The other reason is with aging,
mhm,
normally these problems
mhm,
comes even in the people who are
mhm,
not on dialysis.
mhm,
Okay,
mhm,
so both these things occur. And and then the third is about dialysis. So the people who are on long-term dialysis,
mhm,
like 5 years or more, and then there is a condition called beta 2 amyloidosis, which can also occur in some of the patient because dialysis, as I said, is not the actually best treatment for kidney failure. So it
mhm,
removes some toxin, but it does not remove all toxin. So
mhm,
that is the thing which can also cause the joint problems later. Means if somebody is on dialysis for a really long period of time and not getting good dialysis. So,
mhm,
but that is the last thing. The I would say to prevent this very important is do regular
mhm,
exercise. The regular exercise improves the blood flow in the muscles. It keeps
mhm,
your joint healthy. And secondly, with aging, we know so many joint replacement happening. The aging, this joint problem occurs in a lot of
mhm, mhm,
patients.
mhm,
So that is also, so it has to be seen what is the actual reason cause of this. But if you do exercise, then you can overcome many of these problems of
mhm.
joints and muscles.
Doc, one patient has asked us that um, the mucous membrane of the mouth, dehydration, the drying of the mouth, is it only because patients are not drinking water, or it is also an additional symptom to dialysis?
See, as I mentioned, dialysis is a way to prolong life and keep you going. But what we are doing, we are trying to do the work of the 7 days in 2 or 3 times a week. So obviously, once you remove a lot of fluids, then person feel thirst. But then thirst is also because of the increased salt in the body. If your salt content is high, then you will feel thirst. And so there's a very fine balance between actually dehydration, being dehydration, and being really feeling thirsty because as I said ki that if you are not allowed something then you feel more for it, so that is one of the reason
Mhm,
also for feeling more thirsty during dialysis. But we can, as I said, we can reduce the salt and avoid the food which have more salt and take the cold water, sips of water, and one can really reduce these symptoms.
Now that you made an official statement of when a patient cannot do something, the need to do it is more, there is more need to do it now. In this case, we're talking about drinking water. So there's a question that somebody asked me is not drinking water or fluid restriction and the connection with mental health.
Mhm.
Is there a science behind it? Is it psychological? Can you address that question, please?
See, so basically, as I said, that if you want something and you
Mhm,
are not getting it, so you will be psychologically, you will be disturbed, you will be
mhm,
affected by it. So
mhm,
whether there is a science or not, but there's a clear-cut correlation because
mhm,
you are hungry, you are not getting
mhm,
food, you are thirsting, you are not getting water.
mhm,
It's going to affect your psyche.
mhm, mhm,
But you also have to see the other aspect of it. If you gain too much of fluid and then you develop breathing problem and you
mhm,
have to land up in hospital in emergency, what would you prefer?
mhm,
So you have to keep a balance of both these things. That to take water or to take how much water and to face the consequences if you don't follow it.
mhm,
So there should be a balance. There could not be, cannot be. Yes, nobody can deny it. There would be mental effect on it because then you are you are thirsty and you want water and you
Mm.
cannot drink
Mhm.
more water. But then the way I mentioned, one can reduce the thirst and keep
Mhm.
himself
Mhm.
reasonably hydrated.
Thank you, Doc. Doc, another question that has come up is, again, it's related a lot to joints, movements. It's very interesting, and I don't know if the same answer, but I'm going to read it out, Doc. Many
Mhm.
patients have reduced leg movements and difficulties walking after dialysis. What causes this?
No, so one is that, as I said, that over a period of time, if somebody is not using his her muscles, then they are going to be weak, and that is the one of the most common reason of these
Mhm.
symptoms. And because in dialysis we do remove a fluid and do a function which is not actually physiological, so that is why there is a sometimes there's this feeling of drainage. So to reduce these things, two things: one should not acquire gain too much of the weight of fluid between the dialysis sessions, so your removal would be less.
Mhm.
Second would be to go for the regular exercise, like one can do a cycling at home, so that the
Mhm.
muscles remain strong. Okay, or walking
Mhm.
at least, or doing some other yoga or some other
Mhm.
form of exercise.
Mhm.
That's very important so that your muscles and bone remain strong. Because
Mhm.
over a period of time, these get weakened. Even the people who are not on dialysis, also there is a problem. You see
Mhm.
a lot of patients I
Mhm.
see more than 40, 50 years, even less than that. There's a leg pain, there's a muscle pain, there's a back
Mhm.
pain. What is it? This is all because of the lack of exercise. Your muscles are getting weakened, your bones are getting weakened, and you're
Mhm.
getting these symptoms.
So what I hear you saying is one of the solutions for movement, joint pains on dialysis is the need for patients to work out, exercise, and
Yes.
keep themselves healthy. That really helps to journey
Healthy,
through dialysis.
active, all things. So dialysis is
Okay.
the part of this life. Dialysis
Mm.
is not everything. So you say 8 or 12 hours a week you are spending on dialysis, but the rest of the time is yours, and you have
Mm.
to spend it as you spend otherwise.
Mm. Doc, I'm going to read out a question because patients are also sending me questions over here. Okay. The
Yes.
patient says, I'm a diabetic patient and on insulin. I have noticed that on dialysis days, my CBG falls drastically in the middle of dialysis, promoting the tech to give dextrose. The attending doctors and technicians in the center advised to not to take insulin on dialysis days. But my endocrinologist has asked me to not stop taking insulin. After this happened for a while, I now started eating a few biscuits halfway through dialysis, and my sugar levels have not been dropping. The question is it okay to eat in between dialysis? And if yes, is it okay for a diabetic to eat sugary stuff to prevent sugar levels from dropping? Or are there any other ways to address this? I'm going to add to this question also, Doc. I think one, you can address it from a diabetic patient's perspective of eating something that has sugar on it. But also, I'd like you to address it for a patient who's not diabetic. What do you think about eating on dialysis? And is there a right time in the course of dialysis that a patient should eat?
Yeah. So that's actually very good question and very pertinent. So your dialysis doctor is right, because during dialysis the sugar can fall. So what we advise, if the sugar is falling, then you don't take insulin, or at least reduce 50% of the insulin, whatever dose you normally take.
Mhm.
And even after that, if the sugars are falling, so don't take insulin before the dialysis.
Mhm.
So that advises. If the sugar still falls, then one can take biscuits and whatever sweets is required, because you cannot have hypoglycemia during dialysis. So reduce the insulin to 50%. And if it's still the sugar is going low, then you don't take the insulin altogether. During dialysis, one can eat definitely, but once you eat, then sometime what happens, the blood flow goes to the your tummy, your gastrointestinal system. Sometimes there could be fall in blood pressure. So avoid eating large meals during dialysis. You can have something light during dialysis and don't eat large meals during dialysis.
What about patients who have craving? Like I want to have a green banana, but it's got high
Everything
potassium. Is it
during,
okay to have? Is it the
yeah,
best
yeah.
time to eat, doc? Because anyway, you're getting dialyzed.
After 2 hours, 2 hours, 1 or 2 hours, when your potassium is removed, then
Uh-huh.
what happens at the beginning of your dialysis? Suppose your potassium is 6 or 6.5. Once you start the dialysis, in 2 hours' time, your potassium will come down to 4, 4.5, or this thing.
Mhm.
And end of the dialysis will come 3.5 or something. So in the middle of dialysis, you can have some whatever you want to eat. Everything high potassium you can take.
Mm. Okay. Thank you, Rock. That's a good tip for our dialysis patient to do a little cheating and when to do the cheating.
Yes, yes.
Doc, we've got another questions. I'm going to read it out just the way the patient's written it down.
Hmm.
Since since 2 months, I'm having pain in my upper leg where I've inserted the temp cat on
Mhm.
both my legs. 2 times. One, the first time I inserted was 2003 and the next was 2008 in my left leg. And the first time in my right side. But now in the night when I sleep in the AC, the pain is unbearable. But once I wake up and walk, the pain is gone. I don't know what to do about it.
No, that's quite a long back. Usually nowadays we do not advise to do any sort of the lines in the leg unless it is an emergency. So there one see this thing has to be seen personally. So I would suggest that consult a doctor and do a Doppler if the pain is severe, whether there is any veins or something which is blocked or which is causing the pain. So that needs to be seen by a doctor physically and do a Doppler test if required.
Doc, when we started off the session, I think one thing that we spoke about is when you're in dialysis, there's always a high risk. The
Mhm.
best thing is to move to a transplant, to move to a safer zone.
Yes.
But that's an ideal situation. But we do have, like we have Mr. Ajit here, we have Kamal Shah, where they cannot do dialysis, they cannot do a transplant for whatever might be the reason the transplant failed, and they have to continue dialysis for a long period of time.
Yeah.
What are the tips that you would give them to live healthy and long on dialysis?
Yeah. So, uh, two or three things. One is that
Mhm.
you should have a good dialysis. A good
Mhm.
dialysis means that whatever your doctor prescribe, your requirement of dialysis 2 times or 3 times a week.
Mhm.
Usually, most patient over a period of time requires 3 times a week the dialysis when their urine output is really less or there is no urine output. Sometimes some people may require more if they accumulate more fluid, but otherwise 3 times a week dialysis is good enough. Second important thing in the dialysis is to have good protein diet, because if you are not eating good protein, then you will gradually become weak. So good
Mhm.
protein diet. Third important thing is being active, regular exercise. You should be active both exercise point of view and from social point of view also. That you should engage in the other activities. If your dialysis is going on, it does not mean that you cannot do anything. You can do everything. You have to be active, do other social things. And fourth important thing is your cardiovascular health. Once in a year or so, one should do a cardiac checkup to know, even if there are no symptoms, that whether you are having any developing any cardiac problem. So this is important. And then obviously then you have to take care of a diet in the sense of fluid and everything. But these 3 or 4 things, if you do, then I think you can be on dialysis for as many as years we don't.
Thank you, Doc. Doc, is depression a symptom on dialysis, or is it something that could be prevented through activities and having a bigger purpose?
See, the depression is definitely very common in dialysis, and there is reason to be. means anybody who is on dialysis, he already in a different state of mind, and he thinks my kidneys are filled. It's a more of a taboo and in the mind that I'm on dialysis. So many patients on dialysis, they have depression. How to overcome it? So I think very important thing would be to do your regular work and find a purpose in life and
Mhm.
take dialysis as a part of any treatment, like you are having a heart disease or kidney disease or any other disease, but you are continue to do your work or your activities which you were doing. Obviously, there would be some limitations, but then it should not prevent you from doing whatever you want.
Mhm.
That can reduce. Second important thing is the support of the family, because if there is a support from family, and then the people who have this social support and family support, they do well. And the interaction with the friends and the other colleagues and other activities, I think if you are engaged in all this, then this can be reduced to a lot of extent,
Mhm.
larger extent.
Doc, I'm going to come to a few topics which are considered taboo on dialysis.
Yes.
Okay. Patients picking up HCV, HIV.
Hmm.
Something that I personally noticed was they don't find it safe enough to express that this is what I've picked up on dialysis because the kind of taboo image the disease by itself has. In this case, I'm talking about HIV. What would you say to encourage patients that it's okay to stand up and talk about it? And what is the kind of treatment that is available for HCV and HIV?
So two things. The SCV treatment is now, there's
Mhm.
a good treatment for SCV. We have medicines which can actually cure SCV in 3 months. So most of the SCV is no longer is a bigger problem or a taboo. You take 3 months of the course and 99% of the patient, they are hepatitis C virus free,
Mhm.
and you are back to normal life. So SCV is not a big problem. Second, nowadays, previously it used to be a big problem because we didn't have effective medication. Now coming to HIV, HIV is obviously a problem, but with now again improvement of the medications, I see a lot of patients, many patients. We don't have so many patients like hepatitis C, which used to be previously, but there are few patients. But most of these patients of HIV, they are doing well with medication. Their disease is under control. They can live life as other patients on dialysis do. Uh, Obviously, the social stigma, we cannot do anything with that, but then they can have a reasonably good life, even on dialysis with medicine which are available nowadays. And I have seen many patients who have been doing well, and many patients who be transplanted in HIV when they have been more than 10 years, although they are doing.
Doc, I know you mentioned that social stigma, nothing can be done about it. But as a medical professional, as somebody who sees patients day in and day out for so many years, what advice you would give patients to handle the social stigma when it comes to picking up HIV on dialysis?
I would say that they actually should not discuss with the people who cannot really understand that HIV is one another disease
Mhm.
uh, than than other diseases, and it's a part of the treatment is already going on, and uh, and the HIV people, their life on dialysis is as good as other patients on dialysis if they are taking good treatment.
That's extremely sad that they already have to go through such a difficult journey on dialysis. And on top of that, they also have to keep their life also has to become a secret, which is adding to more complication.
Yeah, so no, that is the part which we cannot really do anything about. So that I think patient has to keep this within the family.
You there, Doc?
Yeah, I'm there. There's some call. Sorry,
Okay,
let's
that's okay.
just disconnect them. Yeah.
Yeah. My next question that I wanted to ask you, Doc, was young couples. Another taboo question, but I think it's important that we address these questions. Young couples, especially if the man is on dialysis, how does he take care of his sexual needs when he's on dialysis? When most of the time, I think it's a challenge for him to have those sexual desires, and that leads to young couples having to break up. And I'm sure it's even if the woman is on dialysis, so you can speak for both genders in this case. What would you normally advise patients?
So I would again advise ki having a good physical health is very important during dialysis, even if you are on dialysis. So for that, the support from partner is very important.
Mm.
That the other partner also understand that there is a problem, and the person who is on dialysis
Mhm.
takes good care of himself in the sense of good diet or exercise or having normal activity, then obviously that during dialysis also there is no reason why a healthy person cannot have a sex, a good, reasonably good sex life. But
Okay.
we will need to really understand this, that the being overall healthy, taking good diet, doing regular exercise, and then obviously the partner need to understand the limitations also, that there is a disease, and that obviously he's not going to be, or she's not going to be as fit as the person who does not have a kidney failure on dialysis, but
Mhm.
that does not prevent that to having a sexual relation with the partner.
So long, my understanding has been that because of medication of high BP, probably the man's needs are more suppressed, and maybe the women also. I don't know, but is that also true, Doc?
No, that's true. So there is a disease which affects all the system. So I am not
Mhm.
saying that this will not affect, and
Mhm.
person could be as normal as person who does not have a kidney failure or dialysis. But even after that, one can have a reasonably good sex life if he actually does a adequate dialysis,
Mhm.
good protein diet, and regular exercise.
Mhm.
So it does not prevent you from being so sexually active or otherwise.
Doc, that brings me to my last question, and this is a very curious question I always hold. If hemodialysis has so much of comorbidities, does peritoneal dialysis also have the same comorbidities? First, that question, yes or no?
So there are a basic difference between hemodialysis and peritoneal
Mhm.
dialysis.
Mhm.
Peritoneal dialysis is more physiological in the sense because your patient is on dialysis 24 hours a day. So there's a
Mhm.
gradual removal of the fluid and a gradual removal of the waste product, and the restrictions are less, the blood loss is less.
Mhm.
But the peritoneal dialysis works for only few years. After that, once the urine output is zero, then it is very difficult to maintain with peritoneal dialysis. Then there are certain side effects of the peritoneal dialysis also, because you still a lot of glucose, there is tendency to weight gain and other problems. So the comorbidity wise, I would say some people they do better on peritoneal dialysis, but some people do better on hemodialysis also. So it's not similar, because the peritoneal dialysis, you have to do a dialysis 3 to 4 times a day. It's really challenging, and the people who are doing it, they are exhausted and fatigued, and then they start doing the infections and other things start coming up. So both the dialysis are good or bad, depending how you do it, how you take it, and how it suits you.
Thank you, Doc. Doc, that brings us to the end of the session, and I would like you to close with one piece of advice for people on dialysis, especially patients on long-term dialysis.
So my one piece of advice would be that dialysis is obviously not the best treatment for the kidney failure, but it is a good treatment. And if you do the things on the right way, then there are very good chances that you can remain well and productive even on dialysis. So, so, and uh, do your work, be active, and the regular checkups, cardiac checkups, these are also important, even if you are doing well, because sometimes you don't know the things which might come up in your test. And if you don't take care of them in advance, then that can create problems. And
Thank you.
dialysis, the other thing is that dialysis is basically artificial kidney. It is doing the work of the kidney. So some people say dialysis, after dialysis, they will get weak or they will get this thing. So dialysis is just replacing your kidney function with artificial kidney as much as possible. So don't get that dialysis has. Obviously, it's not best, but it can give you many good years of life if you make friend with it, rather than always thinking about whether we can reduce the dialysis and which is the thing that lead to the complication. You miss your dialysis, you don't follow the instruction, you will end up in emergencies, and then there are more and more problems. So don't allow this and avoid this.
Thank you so much, Doc, for taking these questions so patiently. I'm sure the patient body is going to really benefit by all the answers you've given us. And it's such a pleasure to connect with you once again on behalf of Kidney Warrior Foundation. Thank you so much for your time, and we hope to stay connected. Thank you, Doc.
Thank you very much for inviting me to Kidney Warrior Foundation and all the patients for listening this Facebook live. Thank you.
Thank you, Doc. I'm just going to stop recording.